Patient's rights and responsibilities. Module content. Module outcomes. Patient rights, with explanation. Patient's responsibilities. Informed consent. Implied of written authorization. Guaranteed maximum response times. How to claim. Patient's rights and responsibilities in Europe. References. Module outcomes. After completing this module, learners will be able to know how to ACT and make use their rights, responsibilities, and know the legal waiting periods, how to complain, what legal consents are, as well as other pertinent information. General patient's rights. Choose services and professionals. Accept or refuse the proposed treatments. Access the appropriate means of treatment. Confidentiality of personal data and information related to your health status. To be informed or not about your clinical situation, treatment alternatives. And probable evolution of your condition. Receive religious assistance. Complain, if treated badly, and receive compensation for losses suffered. Form entities to represent and defend their interests, such as associations. Access the clinical file, be represented and accompanied. Patient's rights. 1. The hospitalized patient has the right to be treated with respect for human dignity. The patient must be informed of the name and profession of all personnel. The patient should be considered as an interlocutor and not a compliant subordinate. The facilities and equipment that the patient uses must be in accordance with their vulnerability and clinical situation. The disabled patient has the right to have facilities that do not present architectural barrier. It is not permissible, except for a short period never exceeding 24 hours, the stay of patients on stretchers during hospitalization. Informal treatment between patients and doctors is totally prohibited. The patient's tranquility must be guaranteed. All discomfort must be kept to a minimum. 2. Inpatients have the right to be treated with respect, regardless of their cultural, philosophical, and religious convictions. The inpatient's cultural, philosophical, and religious convictions, as well as his sexual orientation, must be respected by the health establishment and the respective professionals. Each person is a unique and singular, the protagonist of a history and a cultural and spiritual entity, which for many is defined religiously. All patients are entitled to religious assistance whenever they request it. Institutions must ensure that this right is respected. Cultural, philosophical, and religious convictions should also be taken into account both in therapeutic aspects, for example, colostomy in Muslims or transfusions in Jehovah's Witnesses, as well as in eating habits, as well as some social rules regarding the relationship between people and people, birth and death rituals. 3. Inpatients have the right to receive care appropriate to their state of health, within the scope of preventive, curative, rehabilitation, terminal and palliative care. Inpatients have the right to appropriate care to their health condition that responds to their specific needs and is provided in a timely manner. The quality of care is a right that assists the hospitalized patient. Every hospitalized patient is entitled to treatment of pain. Terminal care, in addition to its technical scientific specificity, must include a special socio-affective component that must be ensured by all staff, taking into account the respect for this stage of life. Patients hospitalized at the end of life or who require palliative care are entitled to be accompanied. 4. The inpatient has the right to continue care. The patient has the right to the continuation of care. The patient's social and financial situation, as well as the articulation with other health services, social security, non-governmental organizations, and private social solidarity institutions, will have to be carried out before discharge. Careful preparation for discharge must begin as soon as possible and taking into account the knowledge of the socio-economic. The patient and his family members have the right to be informed of the reasons for the transfer of the patient. Essential knowledge and information should be provided to home care providers. A family member or person of the patient's choice should be included in the care team residence. 5. The inpatient has the right to be informed about existing health services, their skills and levels of care. The inpatient must be informed about the different services that exist in the establishment. The internal signs must be clear enough so that the patient can move easily within the hospital. The colors, type, and size of the letters should be carefully studied. The services organization charts must be posted so that the patient and visits get to know the organization and its responsible persons. It should be given to the patient at the time of his admission or, preferably, before him, a welcoming manual. In case of linguistic difficulties in accompanying migrant populations, there must be the possibility of using interpreters. 6. Inpatients have the right to be informed about their health situation. The patient has the right, if he so wishes, not to be informed about his health status. A serious prognosis must be revealed with caution and the family members. The information should be given in the most appropriate way to the patient's characteristics and in a context of empathy, confidentiality, and privacy. Minors should be informed, as far as possible, of the acts or examinations. Legally disabled adults or their legal representatives should benefit from appropriate information. Time periods should be allowed for family members to have a dialogue with the doctors and nurses responsible. 7. Inpatients have the right to obtain a second opinion on their clinical situation. The inpatient has the right to obtain the opinion of another doctor of the same specialty. The patient has the right to call on a professional external to the establishment, but in this case, he must ensure the payment of the respective fees. 8. The inpatient has the right to give or refuse his consent, before any clinical act or participation in research or teaching. Professionals should ensure that the information has been understood. Free and informed consent will be registered in an appropriate form, and must be renewed for each subsequent clinical act, being revocable at any time. The patient can always refuse the care that is offered. In cases where, in view of the minor's age and degree of maturity, it is possible to obtain his opinion. 9. The inpatient has the right to confidentiality of all clinical information and identifying elements that concern him. All information relating to the patient is confidential. Hospital records must be kept in conditions that ensure their confidentiality, with special attention to computerized data. An inpatient may request that his or her presence at the hospital not be disclosed. Professional secrecy aims to respect and protect the patient. Confidentiality regarding children who are victims of abuse in the family should be safeguarded as it may jeopardize their own safety. 10. The inpatient has the right to access the data recorded in his clinical file. The inpatient has the right to know the information recorded in his clinical file. Access to the clinical file can only be done through a doctor. This fact, not homogeneous in European countries where there are cases where direct access to data is possible, is intended to facilitate the interpretation of the data and to avoid possible emotional shocks. 11. The inpatient has the right to privacy in the provision of any and all clinical acts. Inpatients have the right to have any diagnostic or therapeutic act performed only in the presence of the professionals. In surgical procedures for children, the presence of a securing element, usually one of the parents, must be allowed in anesthetic induction, in order to minimize the psycho-emotional repercussions. The patient's private life cannot be meddled. With regard to children, private life may have to be investigated, sometimes without parental agreement if this is necessary for the child's therapy or well-being. In the wards, bathing patients should be carried out taking into account the patient's modesty. Respect for the patient's privacy must be preserved. 12. Inpatients have the right, by themselves or by those who represent them, to make suggestions and complaints. The inpatient or his legitimate representative can make suggestions or complaints about the quality of care and care as well as the facilities. The response to complaints should be given in due time, informing of the action taken. This right extends to the legal possibility for the patient, through legal means, to claim compensation for any damage suffered. The patient must assert the rights contained in this document, which emanates from the legislation in force. 13. The inpatient has the right to visit family and friends. The inpatient has the right to visit his family and friends whenever he wishes and the times allow, whenever there is no contraindication. Institutions and professionals must facilitate and even encourage the effective support to the patient. The hospitalized patient is also entitled to permanent monitoring. At delivery, by the partner, or another person designated by the parturient. In the case of hospitalized children regardless of their age and health status. Patients with disabilities, communication problems, or psychological changes. Terminally ill patients. Patients in the emergency department. Visiting times should take into account not only the needs of the services, but also and, above all, the needs of the patients and the availability of the population. 14. The inpatient has the right to his individual freedom. The hospitalized patient may, at any time, leave the establishment, except in the exceptions provided for by law, after having been informed of any risks he runs. Any individual with mental disorders, admitted with their consent, has the same rights to the exercise of individual freedoms as other patients, considering, however, the possible conditions resulting from their illness. Hospitalized detainees have the same rights as other inpatients, within the limits enshrined in legislation. Informed consent. The patient is entitled to receive from health professionals all information about the intervention or treatment, in order to decide. In Portugal, written informed consent is required for specific interventions. Among others, performing surgical and/or aesthetic acts, with the exception of simple short-term interventions to treat conditions on superficial tissues or easily accessible structures, with local anesthesia. Voluntary termination of pregnancy. Prenatal diagnosis with invasive techniques, such as amniocentesis. Voluntary sterilization. Organ donation in life. Collection, analytical study, processing and cryopreservation of blood and tissue from the umbilical cord and placenta. Implied or written authorization. The patient must authorize treatments, exams, surgeries, or clinical trials. Depending on the risk, it can be implicit, verbal or written. For example, when lying on the couch at the request of the professional, for an observation, you give implicit consent. In other situations, as in most surgeries, you need written authorization. The professional must provide all relevant information about the proposed act, in understandable language, and make sure it is understood. A document signed by the patient does not make the doctor not responsible in case of error or negligence. Patient's responsibilities. Respect the rights of other patients, the waiting list and priority criteria for care, the need for rest and silence, among others. Observe the rules of organization and operation of services. Pay your part when you receive care. Collaborate with professionals, provide, for example, the information requested and participate in treatment decisions. Respect the rights of health professionals with whom you have a relationship. Respect the rules of organization and operation of health services and establishments. Collaborate with health professionals in all aspects related to your situation. Pay the charges arising from the provision of health care, when applicable. Guaranteed maximum response times. The law sets maximum guaranteed response times for non-urgent services, at the health center and at the hospital. Each establishment must set its waiting times annually, within the limits defined at national level. In the agreements, the term is the one fixed in the contract with the state. How to claim. Complaint book. Citizen's office. Health regulatory entity. Professional orders. Patients' rights and responsibilities in Europe. In November 2002 in Rome, they launched the European Charter of Patients' Rights basis document that presents the rights of patients throughout the European Union, namely 1. Right to preventive measures. 2. Right of access. 3. Right to information. 4. Right to consent. 5. Right to free choice. 6. Right to privacy and confidentiality. 7. Right to respect of patient's time. 8. Right to the observance of quality standards. 9. Right to safety. 10. Right to innovation. 11. Right to avoid unnecessary suffering and pain. 12. Right to personalized treatment. 13. Right to complain. 14. Right to compensation. However, there are 3 principles that we should stand out. 1. The right of every European citizen to receive accurate information and be involved in their own care. 2. The right of every European citizen to access specialized cancer care underpinned by research and innovation. 3. The right of every European citizen to cost-effective health systems that ensure optimum cancer outcomes.